Often people are referred to my office because they're having some difficulty with reading, which may include sustained focus on the page. I mean, they start off reading well, but within time they really can't focus for very long. And I suggest it may be a visual issue. And they often say to me, "But you know, I have ADD." Many of the tests used to diagnose whether someone has ADD or not are carried out through the visual system, through our eyes. And a person may have 20/20 vision, which means only that they can see small from far. But in the evaluation, they may be carrying out a test on MOXO or a test on TOVA or some other test in which they're either looking at visual data or looking at a screen during the test. We're trying to assess what their sustained attention looks like. Are they able to maintain attention? Now you imagine someone who's struggling to focus with each eye or struggling to team their two eyes together. How will their attention look like? Over the 30 years I've been working, I've seen not a small amount of people who have been actually diagnosed with attention difficulties and are in fact medicated for those, and it actually turns out that all they're struggling with is difficulty in maintaining visual focus, which is something which is amenable to help through optometric vision therapy, and often glasses are part of that treatment package as well, which enable them to focus more comfortably on the page. They may have glasses which help them see well from far, but they're not always the perfect glasses for looking inside on the page for an extended period of time. Sometimes when I'm listening to a student read, I will find they're skipping and jumping. And they will turn to me and say, "You know, I have ADD." Well, let's imagine the following. Two blind men. One has been blind for 30 years and one has been blind for 2 weeks. And they both have to count how many cans there are on the floor in front of them. And there are 10. And they're both standing next to each other. And we say, "Ready, set, go." And they have to count how many cans there are. You know what's going to happen. The man who's been blind for 30 years will count them in a matter of seconds and say 10. And the man who sadly has only became blind 2 weeks ago will have a much tougher time. And he may take longer, and he may say there were 6. Could you imagine that someone would say it was because he had ADD that he took longer and said there were only 6? Could it be? It could be. But that's not the most likely explanation that you would use to explain the difference in the abilities between these two people. One, you would say, clearly has the skill, which he's developed over 30 years. And the other gentleman, who's only been blind for 2 weeks, hasn't yet developed the skill in a way which enables him to move his stick from can to can without skipping any in an efficient way. The other important point is that when he says there were 6, we understand that a motor error created a perceptual error where his stick touched. Those cans existed for him, but the ones he skipped did not exist. But he was fully attentive to the task. He just had a motor difficulty. Now let's see how that transfers to reading. Could you imagine perhaps that if someone doesn't have good motor control of their visual system, they may skip a letter, or skip a word, or skip a line, and that it doesn't have to have anything to do with difficulties with attention? Of course it could have difficulties, but if we don't look carefully at the motor aspects of the visual system, we may come up with the wrong conclusions. I find that so many of the patients who I examine are completely focused in that space of the page. It's not that they're looking all around the room when I'm asking them to read. No, they're looking at the page, but they are not all able to organize the transference of the window of attention, which is inextricably tied up with their ability to move their eye accurately from letter to letter, which is about the motor function of the camera, of the visual system, two cameras together. If that's not happening perfectly well, there will be skipping, there will be jumping. And depending on the linguistic capabilities of the student, they may actually try and guess based on the minimal visual information they're getting in, and so often they reach the wrong conclusion in their guess. If a student only has difficulty attending when they're reading, If they only have ADD when looking in books, that's not ADD. And what we need to do is to really find out the real source of their attentional difficulties when reading. Of course, I'm open to the fact that someone can have ADD and they have a perfectly well-functioning visual system. And of course, there can be people who have a combination of both visual inefficiencies, which are affecting their ability to sustain attention, and neurological situation, which is also affecting their ability to maintain attention. As someone who's experienced over 14,500 patients over the last 30 years, I take making the accurate diagnosis very seriously, and will do all I can to make sure that we provide help when necessary and don't waste a second of anyone's time if looking at their visual skills or developing their visual skills would be irrelevant, futile, a waste of time, a waste of effort and energy, and of course a waste of money too.